Hello, everybody. I hope you all are very well. Good morning, good afternoon, good evening, and good night. I usually say to our webinars, as we have participants from almost more than 30 countries with different time zones. Someone is watching us with pajamas at the moment, I assume. I hope everyone is well. My name is Hakan from Knightsbridge Academy. I would like to make a brief introduction before Professor Esra Uzerçelik will do her session. Knightsbridge Academy is a London, United Kingdom based event, exhibition, education and training organizing company. Actually, we have been established around more than 10 years ago by Dr. Bülent Manav with experience of more than 30 years. We have various trainings. I would recommend you definitely to be a member subscriber of our newsletter and check our website. And then you will see various trainings, including the opportunity to be able to be a dentist or dental therapist, dental care professional in the UK. This is open to you. If you are a dentist, you have graduation as a dentist from anywhere in the world, and you want to make your job in the UK, yes, you can do it. So we work with Knightsbridge Academy, College of Medicine and Dentistry and Ulster University, and made a AGDP program for you to prepare for the ORE exams to be able to work in the UK, to be eligible and to have work permits. For more information, you can check our website or you can email us from info@kbac.co.uk. And I will also share my email address there in the chat session as well. Then I would like to thanks to Saramco, our sponsor, for this webinar with a really wide range of attendance, which is very exciting, honestly. And also now the session will be held by, I will give this microphone to Professor Esra Uzerçelik. She is one of the very few specialists on restorative and cosmetic dentistry in the Turkey and in the wide region. So if you have any question, please don't hesitate to write to Q&A session. In the bottom side, you will see on the bottom right side, you will see an Q&A, questions and answers. If you write down there, all questions will be answered by the professor after the end of the session. So not to interrupt the session, we can't answer the questions during the session, but at the end, she will answer all of them. I promise she will then. So now I will pass the microphone to Professor Özer, and I will share my information with you now. Yep, it's on your hands.
Hello everybody, this is the second part of our training program. Today I'm gonna make a direct composite veneer restoration, so by this way we can talk about tips and tricks for direct composite veneer restorations. First, I would like to introduce the materials and equipment that we'll use today. Composite resin restoration. First we need a composite resin material, and I will use a microhybrid composite from Saramco, and universal adhesive system also from Saramco, but I'm gonna use it with selective acid etching, and this means that I will etch the enamel surface today. For the preparation, because today I would like to show you how to make a veneer preparation, so I'm gonna make a slide preparation, and for this purpose we're gonna use burrs. Which burrs? Depth marker, rounded tip or chamfer burr, flame burr, and a needle burr. For layering technique, we need some hand instruments. First one is this composite spatula. It's very thin and flexible, so it's really to sculpture the composite resin with this instrument. And we have classical composite spatulas. This is Modella from Elamarte. This instrument is a very good instrument because I'm gonna make mammalian effects with this. And we need a composite brush for smoothing the composite resin. We can use scalpel and also explorer. Tweezers. For light curing the composite resin, we need a light curing unit. For making a silicone index, we're gonna need putty system, A-type putty system. For checking the inter-approximal surfaces, we're gonna need a dental floss, and also Teflon band is needed to protect the acid etching effect of the neighboring tooth. For polishing, we will use a polishing strip and magnification. This is very important. I'm going to use a loupe and because it's going to give me a very clear vision. For polishing and finishing, we're going to use discs, finishing and polishing discs. I'm going to use extra coarse and medium for finishing and fine and extra fine for polishing the approximal surfaces. At the end, I will use these diamond impregnated wheels. This means that I won't use any paste because they're really enough, and at the end you're going to show that we're going to get very glossy and shiny surfaces with these instruments. And the metro systems, the contact and contour of the restorations are very important, so we have to use metro systems. You have different choices. You can use sectional matrices or special matrices like Unica anterior. Today I'm going to use Unica anterior, also miter strips. I would like to show you the Unica anterior system. It's a product from Style Italiano. It has a very good matrix for especially veneer restorations. The matrix bands are in different sizes, and there are special designed wedges in different sizes in this system. Next step is shade selection. I explained the details and also principles of shade selection in theoretical part previously. Today I don't have a live patient. I have just this model. And as you see on this model, there are two old veneers. I'm gonna change the left one. So, and also I want this tooth to match the shade of the neighboring tooth, so I'm gonna use Snow White today as a main shade. And I want to make a slight veneer preparation for two reasons especially. One is to show you how to make a composite veneer preparation, and also to show you how to make a mammalian effects. And for mammalian effects, I will need a translucent shade. And as a translucent shade, I'm going to use Incisal Blue. And after shade selection, you have to decide whether you need a silicone index or not. I will need because my preparation will include the incisal edge. For silicone index, I'm going to use a A-type putty system, one portion from catalyst and one portion from base. Also, you have to follow the manufacturer's instructions. As you see, one portion from catalyst and one portion from base, and you just have a 2.30 minutes as a working time. Take a small piece of putty. It should be similar to each other. Take the model, just mix them until you get a homogeneous paste. You have to be patient during all procedures. I think that's enough. Now, take the model and apply it to the palatal surface with a slight pressure. Then you should turn it to the incisal edge. It should include but just incisal edge. It shouldn't turn to the facial surface. I think that's okay. After the application, you have to wait until the putty is set. After the putty is set, you have to remove it from the model slowly and check the silicone index. If there is a bubbles, you can also remove the excess parts with a scalpel for the better adaptation. Okay, that's okay. And check its adaptation again. Okay, there's no problem. Its adaptation is very well. Now our silicone index is ready. Now it's time to make a composite veneer preparation. As you see, there are old veneer restorations and I have to remove them. I think 0.5 millimeter depth will be enough for me to remove this old restoration, but I have to limit my preparation depth on facial surface, so I'm going to use depth marker burr. And as you see, I will start from the facial surface. When you use a depth marker, you have to pay attention to the inclusion of the facial surface and you have to follow the three planes of the facial surface in maxillary central incisors. Because it has three planes, during making a preparation on cervical area, you have to follow its inclusion. Then on the middle part, you have to change the axis of your depth marker, and incisal, in the incisal parts also you have to make another change in the axis of the burr. Okay, let's start to use it with a low RPM. make a marked grooves, and also I'm gonna make a groove on the incisal part. Yes, I think that's okay. I advise you to draw these grooves with a pencil. Yes, it will limit its preparation depth. And then you have to make a preparation until these marked areas will be disappeared. I'm going to change my burr. And now I have to use rounded tip tapered burr for making a chamfer. This is also called chamfer burr. Now I'm on facial surface. Just work on facial surface, not gingival, and try to remove all the marked grooves. In the clinical situations, it's easier because you generally work with high-speed handpieces. And during facial preparation, do not disturb the contour of facial surface. It's really important. You just make a reduction. Okay, now all the marked areas are disappeared, but I have to check the surface because my main aim is to remove old restoration. I think there's some remnants of restoration still on the surface, so I have to keep on preparation. Yeah. And also you can check the preparation depth from incisal surface. Clean the surface, and by this way our facial preparation is finished. Now we're gonna go on with the gingival preparation. I'm gonna wear my loops. I will make a very small chamfer in the gingival area. Its level should be in the same level with the gingiva, or at most 0.5 millimeter into the gingiva if you want to change the shade of the tooth. Yes. The preparation of direct composite veneer restoration is completely different from the indirect. Ceramic veneers. Yes, very small preparation is enough in the cervical region, and after you complete the preparation in the gingiva, now it's time to make a chamfer in the proximal surfaces. The direction of the burr should be from cervical to incisal. I don't want to open the contact area because there's no problem, no diastema, no crowding. And that's enough. And also you have to make a chamfer in the mesial surface. To protect the neighboring tooth, you can apply a mylar strip or metal band during also preparation. Okay, now approximal surfaces are also ready. The last part is preparation of incisal surface. You have two choices. You can make a reduction in the incisal area, especially if you want to make a marked mammalian effects and also translucency. But also, you can make a feather-edge design and just thin the incisal part of especially 1/3 of facial surface. In this case, you can use this part as a palatal wall. In this exercise, I'm going to make a reduction in the incisal edge to show you how to make a mammalian effect and translucency in the incisal 1/3. First, also, I'm going to make a marked areas grooves with my burr. Its thickness is nearly 1 millimeter, but if you make a reduction, you have to catch the thickness of 1.5 to 2 millimeter in the incisal area. So I'm gonna make a reduction nearly in 2 millimeter depth. Now it's nearly 1 millimeter, but I have to increase it to at least 1.5 millimeter. So I'm keep working on this area. I think now it's 1.5 millimeter, nearly. I will make another indicator. Yes, that's okay. Again, you can draw these areas with a pencil. Yes. Then make the reduction in whole incisal edge. Okay, now it's not very smooth and you can use discs for smoothing this surface better. You can use discs for smoothing the incisal edge. I advise you to use small disc. Now it's very smooth. As you see, also there are very sharp edges in the mesial and incisal and in the distal incisal area. Also you can round this part with discs. I'm gonna use medium one for this purpose. Let's round these sharp areas. It will facilitate to insert the mattress band into the approximal surface. And also we have to do it in the distal part. Yes. Okay. It's almost finished. I'm gonna make minor corrections now. First clean the surface and check the preparation. In the approximal part, the junction between the restoration and the sound tooth shouldn't be visible, especially if you want to make a change in color. Because it can disrupt the passion. Take the junction as much as possible to the backward in the approximal surface. So I think it's okay. In the palatal area, I prefer butt joint design. It's better for preventing any fracture. And also, I'm gonna thin the incisal edge a little bit, the facial surface of incisal edge, to make a smooth transition between the restoration and sound tooth. Yes, I think that's enough. As a last stage, also you can smooth the preparation with rubbers. It's not obligatory in direct composite preparation, but you should smooth the whole surface very well in the indirect preparation. Clean the surface, and now it's time to final check. Check the surface from all aspects, I mean from facial surface, from incisal area, and also proximal surfaces. Now okay, I think everything is okay now. Our preparation has finished. I advise you to check the proximal surfaces with a dental floss. If there's a problem in the placement of the dental floss, okay, everything is okay. Now our preparation is ready. Next step is the adhesive system application. First, I'm gonna use the acid etching gel on the enamel surface, but to protect the neighboring teeth, I have to apply Teflon band to them. Take a piece of Teflon band. Apply it from the proximal surfaces. First, lateral incisor. Yes, that's okay. Very good. And then take another piece. Apply it to the central incisor from the proximal surface. Okay. Smooth the surface. Now it's okay. Take the acid gel. Check its tip. Okay. Apply to whole enamel surface that you're gonna make the restorations, I mean facial surface first. Apply it with agitating to prevent the formation of the bubbles. And to the proximal surfaces. There shouldn't be any gap. And the last surface is the incisal. We're gonna use universal adhesive also as include acidic monomers, so 10 to 15 seconds is enough for acid etching of the enamel. After this period, remove the acid gel from the surface by air-water syringe, and you have to apply the water until you remove all the acid gel. It generally takes 15 seconds. Unfortunately, I don't have a air-water spray, so I'm gonna take it with a wetting towel. Okay. I'm trying to take cool acid gel. I think that's enough. Also, I'm gonna use a brush to remove the residual acid from the surface. Clean the surface. Okay, now there's no remnants. The second step is the application of the adhesive system. As I said before, I'm going to use a universal adhesive. I think 1 drop is enough for whole surfaces. Yes. But I'm going to change the tip of the brush. Where's my brush? Yes, here. Again, apply it to the whole surfaces. And you have to obey the manufacturer's instructions. According to manufacturer, you have to apply it for 20 seconds with a gentle rubbing. After this period, you have to remove the solvent with an air syringe. You have to apply the air syringe gently. Also, I don't have an air syringe today, so I'm trying to thin the adhesive system with my brush. Yes, after this procedure, you have to light cure it. You have to also obey the manufacturer's instructions for the period or the time period for light curing for this adhesive system. This is 20 seconds. You have to apply light curing unit from different aspects, from facial aspect and also from incisal aspect. Okay, then it's finished. The next step is the creation of palatal wall, but before this procedure, I want to remove the Teflon band from the proximal surfaces. Yes. Now it's time to layering sequence, and we're gonna start from creating a palatal wall. We're gonna use our silicone index to create a palatal wall. First, check the adaptation again. Okay, there's no problem. And with your probe, please indicate your incisal edge on the silicone index with a probe. I can see the mark, but you have to clean the surface. Okay. For palatal wall today, I'm gonna use enamel shade, or my core shade, I mean. But also you have one more choice. If you want a very translucent incisal area, incisal 1/3, also you can use a translucent shade. Take a piece of composite resin. And place it into the silicone index. At the beginning it can be a little difficult because the surface of the silicone index is very shiny and smooth, so the adaptation is a little bit difficult. But be patient, and with a slow movements, slow pressure, probably you will adapt it to the index. You should extend it beyond the marked area for a better adaptation, and remove the excess material from the proximal surface, because probably it will prevent the insertion of the mattress band, and during this insertion you can fracture the palatal wall if there is excessive material in the proximal area. Okay. After all layering process, you have to use your composite brush to smooth the surface. By this way you're gonna get very good surface. Don't forget to use your composite brush. Now that's okay. It's time to adapt your silicone index to the model, yes, and checked the palatal wall, especially check the proximal surface again, remove the excess material, and then light cure this palatal index with your light curing unit. I'm using LADA, light curing unit. You can remove the silicone index now, but you have adapt about the adhesion of the palatal wall. Also, you can use your flowable composite. You can apply a small piece of flowable composite into the junction of the palatal wall and the sound tooth. Now, I will remove the silicone index. Slowly. Be attention not to fracture the palatal wall. Now I think everything is okay. Very perfect palatal transition, as you see. And don't forget also to light cure the palatal side. Okay. Now our palatal wall is ready, as you see. There's no problem in the proximal area also. Yes. In anterior restorations, the right contour to create a good contour and approximal surfaces is really a critical step, because you have to follow the emergency profiles and you have to also make proper contact areas, and there shouldn't be any overhangs through the gingiva. So we have to use matrix systems. There are different alternatives. In this exercise, I'm going to use Unica anterior system. First, you have to choose the proper size. I need a small one. This will be okay for this model. And as you see, the contact areas are located in the incisal third in this model, so we have enough space for gingival embrasures. I need a thick wedge. Also, I need a light curing resin. First, we have to place the Unica anterior. Also, you have to follow the manufacturer instruction. As you see from this figure, this groove should be through the incisal area. First, place it into the approximal areas. Okay. Now its adaptation is good. Place the wedges into the embrasures, and also they will stabilize the band. Okay. And the second one. You have to check also the cervical area. If there's a problem in the adaptation, now you can use this resin material to adapt the band through the gingival part. And light cure it. Check its polymerization and okay. Now it's okay. And we're ready for creating approximal walls. After the adaptation of the mattress system, take again small piece of composite resin for creating a proximal walls. Also again, I'm using the standard decor shade for the approximal surfaces. Start from the first cervical area. I always advise you to remove the composite residues from your hand instrument. Why? Because unfortunately they can prevent your gentle motion. You can use a piece of paper for this purpose. Yes, I've finished the cervical part. Now I turn to the approximal area. I need more composite resin. Apply it carefully. There shouldn't be any gap. This is very important step because this will determine the mean shape of your tooth. With this mattress system, you can apply the composite from both incisive, both approximal surfaces and also cervical surfaces. This will facilitate your application. I'm going to take also a piece of paper for cleaning my spatula. By this way, you make a frame with composite resin. And after the sculpture with an instrument, you have to also use your composite brush to smooth the surface. By this way also, you prevent the formation of bubbles and gaps in the structure of the composite resin. I think now we have a very smooth surface. Everything looks perfect. So and also check the emergence profile, the shape, incisal part, and light cure. From facial surface and also from the incisal aspect. Okay, then remove the mattress band. First wedges. And then resin. Okay. The last step is to remove the mattress band. The adaptation is bad, so sometimes removing it can be difficult. But always apply gentle force. Yes. Check the approximate surfaces, no gap, no gap. As you see, there is a frame around the tooth with the composite resin, everything okay. The contact areas, yeah, okay. And they're located in the incisal 1/3, incisal 1/3, and embrasures. They're also okay, there's no overhangs. Sometimes this resin sticks to the composite, but you can also remove these remnants at the end of the restoration during finishing and polishing. Yes, our approximal walls are ready. Next step is the forming of the facial surface. I will use again Snow White, my main shade. This time take a large piece of composite. Apply it to the facial surface. And also I'm gonna need a piece of paper again. Try to get the right contour of the facial surface. First try to adapt it to the cervical area. there shouldn't be any gap. Yes. And also check it from the incisal surface, because especially compare the thickness with the neighboring tooth, with the symmetrical tooth. Take the excessive part from the incisal area. Okay. Our restoration now is a little bit in front of the symmetrical part, but it's not a problem. During finishing also you can solve this problem. Always check it from the incisal part. This is really so important to get the right inclination, right axis also. Take the excessive part. After sculpture, use your composite brush. If you use one shade, you can finish this stage, but we're gonna use also translucent shade because we want translucent effect at the incisal 1/3 of the restoration. So check again from the incisal area. Okay, everything is okay. Now I'm gonna make cut back procedure and I'm gonna remove the composite resin from the 1/3 of the incisal area of the facial surface. Sorry. Take the composite back from nearly 1/3 of the restoration . For a more translucent incisal part. and I'm trying to see the underneath preparation. Take the excessive part also from the incisal and palatal surface. Now I removed the incisal third, but also I want to make some mamelons. I would like to make some grooves where the mamelons would be. There are different styles for the mamelons. I prefer the basic one. I'm trying to extend them through the incisal area. This is the model, so I don't consider the symmetrical one, but in clinic you have to consider the symmetrical tooth mamelons, shape and also width of the mamelons during making them in the restoration. And then smooth the surface again with the composite brush. As you see, we have a very good mamelons. Before light curing, you have to check the approximal surfaces with mylar strip. There can be residual composite. Okay. That's okay. Check again all surfaces. Okay, I think maybe everything is okay. Just take small parts from here. Okay. Yes, light cure them. Also from incisal area. And check the mamelons. The space between mamelons, okay, no problem. In this exercise, our final shade is incisal blue. I prefer this shade because I think this shade will pick up the mamelons very good. Also take a large piece of composite and apply it especially onto the incisal 1/3 and middle 1/3. Again, start from the cervical area, middle 1/3. Try to give the right counter again. Check it from the incisal area and take the excessive parts, okay. Now take your brush. You also can use wetting resin, but in this case I don't need. And then apply the minor strip into the proximal areas again to remove the excess composite residues from the proximal surface. Check it again. And light cure. We finished the layering process. Our restoration is now ready for finishing and polishing. After the layering process is finished, we're going to make the finishing and polishing. First finishing, and I will start with creating a primary anatomy. This is important in primary anatomy because we determine the general shape, length, and also axis of the tooth. You have two choices. You can use burrs or discs for primary anatomy. I generally use discs, and the coarse and medium one. You may use both large and small ones. And also you can use burrs, rounded tip burr, for especially cervical area. You can check the thickness from the incisal part because it should be in the same level with the symmetrical tooth. In the clinic, when you're using discs, I advise you to use also a water syringe. Because heat during this process can be produced, and also it can unfortunately cause some cracks on composite resin. Still left one is a little bit in front of the right one. Now they are in the same line, and I'm gonna cut the incisal edge. And also you have to check the incisal length, the length of the tooth from in front of the patient. Use the small one. Okay. Now we finished the shape, length and the axis of our restoration. Also, we're gonna go on with primary anatomy now. We have to prepare line angles, incisal embrasures and also facial embrasures. You can draw the line angles with a pencil according to the symmetrical tooth line angle. First you have to determine their places and you have to draw similar line angles to your restoration. Yes. These line angles are very important because it gives the final width and also shape of your restoration. First, I will use burr for the cervical area. Adaptation of gingival margin is very important for gingival health. There shouldn't be any overhang. Now I will again use discs for line angles. You can use them in very low RPM. It's okay, we get similar shade. can take a football burr and get the excessive material from the palatal size. By this way, you can determine the incisal edge location. And the next step is incisal embrasures. Okay. As you know, maxillary central incisors has a rounded distal corner. It should be nearly the same with the symmetrical tooth, so we have to enlarge it a little bit. Okay. Symmetry is very important for central incisors. We finished the primary anatomy. For secondary anatomy, I would like to make developmental grooves, and I'm gonna decide this patient as a young patient, so I'm gonna make 3 lobes and 2 developmental grooves. Generally, mesial one is a little bit longer than distal one. And also you have to consider, you have to mimic the symmetrical tooth, developmental grooves. As you see, it's the same, the grooves on my restoration. But don't forget, it should be groove. There should be lobes and grooves.
Hocam çizilmiş halini gösterir misiniz? Bakıyorum. Evet.
I will use round tip taper burr. This one is better. Start from the incisal part. It shouldn't be very sharp. I generally try to make rounded grooves. I prepared the grooves, but now they're a little bit sharp, and to smooth them, I'm gonna use diamond impregnated wheels and rubbers. First, I will use rubber to show the depth of the grooves. You can see its depth. They needed a little bit to be rounded. Yes. After this, I'm gonna make small corrections on the line angles. I need discs. Yes, that's okay. I'm trying to get very sharp line angles using these discs in two planes, a proximal and also facial surface. By this way, we finished the secondary anatomy. We made our grooves. Now, tertiary anatomy to form the Perikymata. I will use also flame burr for this aim with a low RPM. The Perikymata are very clear in the symmetrical teeth, so I would like to make very clear Perikymata on my restoration. This is very important. Make lines on the restoration with the tip of your burr, like this. Its step is up to you, up to the symmetrical tooth. And my line angles are ready. Now the last step, polishing. You may use aluminum oxide or diamond pastes, but today I'm just going to use diamond impregnated wheels. This one, the fine one, is a very good equipment, I think. It facilitates the polishing step very much. We have the Perikymata, so polishing probably will take some time. But keep doing that to get a very shiny surface. It should be like a glass. Keep on polishing. Yes, at the end we get very glossy, shiny surface, as you see. Our polishing also is finished. And also we're gonna polish the proximal surfaces with a polishing strip. You can use epitax for this purpose because it's very thin. Use these strips under the contact areas, and you can also adjust. You can do minor adjustment in the contact area. Yes, at the end we finished our restoration. Let's control it, check it, and compare it with a symmetrical tooth. Its shape is proper. We have the similar shape with a symmetrical tooth, and it looks like a central incisor. And also we get good contact points. I can see the line angles, grooves, and also Perikymata. There are no excess material on the palatal surface. Incisal edge is located in the proper place. And we have a very shiny surface, as you see. And also we have a very good and natural translucency on the incisal third. And we can see the mamelons also. And if you want to see mamelons very clear, you can use different devices. So, with the help of this light,
Hello, everybody again. I hope you enjoyed it, and I hope you can hear me. Now it is the Q&A session. I can see 9 questions at the moment. We will add Professor Esra now to the screen, and you will be able to ask your questions to her directly. So we have 9 questions. Please keep writing to the Q&A side, and she will be answering your questions one by one. Yes, Professor Esra is here, and I'm passing the microphone to her. And you have only 9 questions. Don't worry.
Okay. First, good afternoon, everybody. And it's the end of our second part, I think. I made a composite veneer restoration, direct composite veneer restoration on a model. Yes, I can take questions. Sorry, but I couldn't see any question. I think it's about the time that I'm in this organization now. I just can.
Oh, can you see? Can't you see the Q&A session? I can read the questions for you. If you can't see the Q&A part, I can read the questions.
Okay. I joined to the program, so I think I couldn't see the past questions.
No worries, I'm reading it. Louisa asked, what is your opinion about composite veneers restorations without prep?
Prep. Yes, prepless composite veneer. Direct composite veneers also can be made with prepless technique. Is especially we use prepless technique on some situations like worn or abraded tooth. Yes, we can use it without also prepless technique.
Can you just tell me next question, or just give me a signal then not to interrupt you when you finished your answer? Then I can read the next one.
And second one.
Louisa again asked, how did you measure the quantity of composite on cervical area using this Unica matrix system?
Sorry, can I take again the question?
Right. How did you measure the quantity of composite on using this Unica matrix system? I don't know what Unica matrix system is.
Yes,
Unica matrix system.
Yes, the metric system that I use to make a proximal ball. Yes, I can also compare its thickness with the symmetrical tooth because it shouldn't be very high. And also, I think wearing a loop is very beneficial, especially to see this to see these small areas very clear. You have to use loops or the other magnification. It will be beneficial. But just using visual technique, I'm trying to decide the amount of composite that I will use in the proximal area or facial area. Yes. And the other
an anonymous attendee asked, what are the advantages of direct technique when compared to the indirect one?
Yeah, there are lots of fighting advantages. The main advantage, I think, is the cost of the procedure. Generally, our patients prefer direct composite restorations because it's more economical compared to indirect ones. In Turkey especially, I don't know the situation in the other countries, but in Turkey that's the situation. And second one, you can make very minimal invasive restorations. I mean, you can make composite veneer restoration also without preparation. Also, you get very natural results with composite. If you, if you can mimic, if you have a good technique, if you and you can mimic the symmetrical one, nobody can understand that there's a restoration understood. Is also one of the advantage of composite material. And also you can repair or you can solve some problems with minor intervention when you use direct composite technique.
I'm going to the next one. Do I need to use dentin and enamel shades or just a universal shade since my prep is within the enamel?
Yeah, if your prep is within enamel, we generally prefer enamel alternatives because some, not just enamel shade, but some of the other shades also can be used as an enamel alternative shade. Enamel shade is one of them, but also we can use core standard or universal shades on enamel, especially if we encounter with more opaque enamel, because all enamel is not in the same translucency or opacity. But I can say that we don't generally use dentin or opaque shades if there's no discoloration or there is no area that we have to mask. So you can use also enamel shades and the other enamel alternatives like core shades and also standard or universal shades on when your prep is on enamel. It's up to the opacity of the underneath tooth, or the opacity of your enamel. Okay.
I'm going to the next question.
Yes,
Again, the next is from the same Dr. Mahmoud Hisham. How to know that I don't need other composite layers facially, in brackets, what makes me say that there is no need to add composite in order not to be bulky facially?
You can, okay.
Did you hear the question? Sorry, it's a bit noisy.
Can I take the question again?
Yeah. How to know that? I can try to send it directly to, just 1 second, please, as a text as well. Let me try to copy and paste the question directly to you in your chat box. Maybe this will be easier.
Yes. How to know that I don't need other composite layers facially? What makes me say that there's no need to add composite in order not to be bulky facially? Yes, okay. This, I think, a good question because first you have to decide it in the treatment plan step. Yeah, you have to make a good treatment plan. You have to evaluate the initial case model of the patient. First, you have to plan the average thickness of your veneer at the beginning of the restoration, I mean before starting the restoration. And also you have to start from central incisors first, and then also you can use and after that, when you catch the symmetry of central incisors, then you have to make laterals and also canines. First you have to, I think, also make central incisors. Also, you can use silicone index. I mean that first you can make a wax up on the case model and you can take a silicone index from buccal side. This silicone index should include buccal side, incisal and also palatal side. And using this silicone index, also you can adjust your facial depth. But if you get experience, generally you don't need You can also do it without this silicone index, but at the beginning you can use such tools for better restoration.
I'm sending the next question from Abrick. Yes. In real tooth, do you finish the restoration with high speed or low speed handpiece? It's in your chat box as well.
Yes, yes. In real tooth, do you finish the restoration with high speed or low speed handpiece? I think it's up to the thickness of the restoration after finishing. If you do the sculpture and also if you use your hand instruments and brush well, you get a very fine and good finish restoration after the finishing procedure. In that case, in this situation, you can do it just using low speed handpiece. But after finishing procedure, if you have a very thick restoration, in this case, you can use also high speed first to remove the very excessive part, and then you can use low speed.
I'm sending another question from the same doctor.
Okay. When you apply the incisal shade, do you apply usually from the middle 1/3 to the incisal 1/3 area? Also, it's up to you that you're just making one tooth, one veneer, or more than 2 veneers. Because if you make just one veneer, this means that you have to mimic the symmetrical one in all aspects. I mean shape, also size, also and also shade, and also the translucency of the incisal third. So, but if you make more than one veneer, then it's up to you. It's up to your aesthetic. And your patient. You have to discuss this before the treatment with your patients. I think you have to show some samples to some photos that belongs to your other patients to adjust the translucency of incisal edge. It's up to you. If you don't have any reference, I mean, if you don't just make just one restoration. But I generally try to make a translucency in incisal third because I think it gives a very natural appearance, a very natural transmission from middle third to incisal third.
Next question is from Dr. Manal Al-Hussein.
So direct veneer can be done in one visit. Isn't too long process. Yes, in this exercise, it takes a longer time because I try to show all steps in detail and I try to explain it in detail. So, but in clinical situations, generally it takes 30 minutes to 1 hour. It depends on the underneath tooth. I mean, if there is caries or old restoration, it takes longer time. But if just you do a thin veneer restoration, it takes shorter time in the clinic.
Always you are answering the questions. This time I will be answering. This is my turn. The next question is from Dr. Arya Mohammed Safi Kader. Doctor is giving thanks to you for the course and the organizers. Then asking if it's possible to get videos after the course.
Unfortunately.
Yeah, all answered. So the next question I'm just sending to your chat box from Dr. Zamira.
Yes, I can now see the further questions because it's after 6 o'clock. 6 p.m. So I can see the other question. There's no need to.
All right.
Okay.
Okay. Yeah, it's after. Okay. That's good.
And there's a question from Dr. Zamira. Which mattress system did you use? I missed that part. Thank you. You have different options for as a mattress system for composite veneers. You generally bands of sectional mattress is used. But in this exercise, I used Unica anterior mattress band. It's really a good alternative, I think, for direct veneers, if also there is no diastema. And also, it's just a brand. There are lots of brands in dental market that suits this mattress system. You can prefer one of them. But for especially diastema closure, you can use also BioClear mattress. It's a good alternative. Also, you can get very fast results with such kind of mattress, BioClear mattress also. But it's used for just diastema closure, not for composite veneers. Okay, and the other question. Can you hear me?
Yeah, I can hear you.
Okay.
Can you read that?
I couldn't see you. So.
Yeah, I can read it for you if you can't see it.
Okay, thank you. And the other question, which type of composite I can use for direct veneer? Which shade I mean? Yes, you can shade, enamel shades you can use, and also incisal or translucent shade for also creating incisal area you can use. And if there's a discoloration, if there's a severe discoloration, you can use opacers. But these are special design composites, and they are generally used in very thin sections like 0.1 to 0.5 millimeter. You shouldn't use these opacers in thick sections. And also you can use opaque or dentin shades if there is a medium discoloration. If it's not very severe, but there's a clear discoloration on the surface. Also, if you're undentin, you have to use. If your preparation, if some parts of your preparation on dentin, especially when there's a caries or some defects, also in that case, you also use dentin shades with enamel shades or the other shades. I think it depends on the etiology of the pathology. What is the procedure for composite veneers for fluorosis patient? Also, this is a good question. Yes, in fluorosis, if there is, it's a question from Javad Ahmad. Also, it depends on the severity of dental fluorosis, because we can encounter dental fluorosis in different severity. It's very important because, for example, I think it affects the size of the lesion on the surface. Also, it affects the color of the pathology. In some fluorosis case, we encounter with just opaque stains, but in some patients also we can encounter brown stains on fluorosed tooth. So the thickness, preparation thickness, and the materials that we'll use on these patients also depends on the severity of the fluorosis teeth, because also there can be defects on such kind of lesions. But the technique is similar. If there's a need for preparation, I mean, you just, for example, do one restoration and the severity of the discoloration is severe. In that case, you can make a preparation. You have to make a preparation. But if there are just small opacities, and if you're gonna make more than one restorations, generally restorations from canine to canine, then you can also make veneers without preparation. It depends on the severity of the fluorosis, and if there are the other abnormalities that accompanied by these stains. Okay, and the other questions, what the thickness of enamel layer and its change? Yes, the thickness of the enamel layer varies, and it depends on the preparation depth. And also it depends on if there are any stain on the surface. If you have to mask any abnormalities, it can be a severe discoloration, or it can be a caries, or it can be an abrasion lesion. It depends. So it depends on the preparation depth and the etiology. And Hatice. Hatice Erçetin. Okay, dear professor, would you prefer to renew or fix the veneer restoration when there is a small fracture? Also, it's a very good question. It depends on the location of the fracture. If the fracture or if the little small fractures are on labial surfaces or on facial surfaces, I mean that on the location far away from the incisal area, in that situation, you can use repair techniques in that case. But if the fracture, small fracture is on incisal area, in that case, I generally prefer to replace the restoration. But also you can try, in that case also you can try repair process, but I prefer to replace the restoration in that case. Unfortunately, there are limited research about the performance of repair techniques in direct composite veneers. So I couldn't say, I couldn't make any comments on this topic according to the evidence-based dentistry. It's just my preference according to my clinical experience. And Mohammed, which type of composite put in proximal area? Yes, also it's a good question. Also, yes, generally we use enamel shades or standard shades. But if you want small translucency also on approximal surface, you can make a very thin approximal walls with incisal or translucent shades. Also, it's up to the aesthetic appearance that you want to catch at the end of the restoration. But I generally prefer enamel shades or standard or core shades, universal shades. Yes, what about 3D printed composite veneers? Also, yeah, 3D, this a new technique, this a new era, I think, but it's in this technique can be classified in indirect restorations, not for direct restorations, because we have to cement such kind of restorations onto the tooth. 3D printed composite veneers could be good choices. The main limitation of this technique is the shades. I think they're developing materials nowadays, but there are limited shades. There are in limited shades. So I think you can make a good monochromatic restorations, just monochromatic restorations with this technique. And the other question is from Dr. Prijin. How can I polish the interdental area and prevent it from future discoloration? Yes, for polishing interapproximal area, you can use some brush. This brush includes silicone carbide, and their shape is compatible with the approximal area. So you can use such kind of brush for polishing the approximal area. If you want, you can also use discs, fine and extra fine, but I prefer this brush. I also talked about this brush in the theoretical part of my presentation. You can get such kind of materials from dental market. You can use that. And a question from Dr. Mavabatta. When using the diamond polishing burrs, is there any direction a person should follow? For which procedure? Because for different procedure, you can use the diamond burrs in different direction. Afaf Hamid, which mode of curing you prefer to use, normal or soft mode or other modes? Yes, I generally prefer normal mode in composite veneers, but also you can use soft mode. But during using soft mode, please pay attention to increase the curing time. It's important because in soft mode, first you give generally low intensity light, and it's getting higher in time. So in generally soft mode, if you use soft mode technique, you have to increase the curing time. What is the difference between, oh yes, in its precision, what's the difference between opaque A2 and OPA2? Yes, there are different codes in dental markets, in different dental products. And also you have to evaluate its catalog well to distinguish this difference. This is, I think it belongs to Tokuyama. I think Tokuyama, not Asteria, Estelite. One of them is more opaque compared to the other. OPA2 is more opaque compared to OPA. The difference is in the opacity of the materials. So you have to know your materials very well, not just shades, also their opacity and translucency. After that, you can decide, can I use it as a dental shade, or can I use an opaque shade, opaque shade, or can I use it on enamel as substitute for enamel? It's very important. You also have to know the opacity of the shades in the dental composite set that you use. Okay, another question. Indirect veneer. Another question from Hint Isam. Indirect veneer. What should I consider to make final results proper? So I couldn't understand this question. What you mean? What should I consider to make my final results proper? So I couldn't understand what you want to know in this question.
Dr. Isam, can you just please rewrite the question and then give some details to your question?
Yes. I need some detail. And know then Ali Al-Mayali how to select type the finishing line. How to select type the finishing line. Yes, you can first evaluate the symmetrical tooth finishing line if you're just making one veneer restoration. But if you want to make more than one veneer restoration, if you don't have a reference, in that case, first you have to decide the shape of your veneer restorations. I mean, you're going to make a triangle, you're going to make a triangle shaped tooth or oval shaped tooth. And after that, and also you have to decide first the width of facial surface. After that, you can decide the location of and the shape of your line angles. Because if you want a triangular shape at the end, then you have to follow a triangle X when you're making a line angle. Okay, you can adjust the shape and also width of the facial surface by changing the axis and the direction and the location of the line angles. And a question from David. Hello, if it happens to be a fissure or crack, how to fix it? Yes, also I answered a question similar to that question. It depends on the location of the fracture or fissure. If it's far away from the incisal area, in that case, you can use repair techniques to solve this problem. But I think if it is close, according to my clinical experience, if it is close to the incisal area or on the incisal area, I generally prefer to replace the restoration. But this answer does not, unfortunately, depends on evidence-based dentistry, because unfortunately there's no research about repairs, about clinical performance of repair techniques on composite veneers. It's just, I can say, just from my clinical experience, I generally prefer to replace the restoration in that case. Yes, I think I answered maybe all the questions.
Wow. Questions finished. If you have any other question, you can just, we got one more. Oh, thank you. All right. You're welcome. I'm applying on behalf of you the thank you questions. I just say you're welcome to them. Yes, thank you very much, Professor Esra, for these kind of presentation and this education. And we would like to thank to our sponsor, Saramco, and as an organizer, Knightsbridge Academy. As mentioned in the beginning, maybe some of you missed, we are a United Kingdom, London-based education training company. We can also support you to be a dentist or dental care professional in the UK with our various training programs and examination programs. And you can reach us from info@kbac.uk and also find us from our contact details from the website. Please follow us. Check out your emails, be a subscriber to our newsletter and get more information. I will write down to the chat box again and last time our email address if you have any kind of questions about our education and if you want to be a dentist in the United Kingdom. Yes, thank you very much, Professor Esra. Thank you very much, all attendees, everybody. You are very patient. I was here. I didn't understand anything as I'm not a dentist, but I've just seen many things happen there. And very much again. See you next time on Friday.
On Friday, yes.
On Friday, yes. Okay then. Have a good day. Take care.
Okay.
Bye-bye.
Bye-bye.